antibiotics, pain medicine. Okay, usually the pain for this procedure is the same as they had for tooth extraction, right? So when patients ask how much will it hurt, is well, how much did it hurt after you had your teeth extracted? Okay, because what they can expect post-surgery is about the same, right? And so is about the same amount of pain. All right, so they can take the same medication. Is maybe something to keep the nose clear for breathing, decongestants, okay, and then maybe to prevent too much swelling. Okay, some steroids, and that's it. All right, decongestants, pain medicine, and then the instructions post-surgery are the same instructions that you would give after tooth extractions. Okay, is try not to rinse your mouth because it will disturb the blood clot. Right, is try to eat the food, not swish the food around because again, not to disturb the blood clot. Try to eat cold foods the first day, so it shrinks the blood vessels, so there isn't much bleeding. Try to eat warm foods the second day, so that it brings warmth to the area, so there's more blood coming to the area to allow for maximum healing. Okay, try to minimize or avoid cigarette smoking for about a week. Okay, so again, the same type of instructions you would give after is after tooth extraction. And then what I do is some folks write it on a sheet of paper. I made a small booklet, and so we made this booklet about 100 pages that gives post-operative instructions, has some menus in it, what foods they can eat, a little bit of information on what vitamins they can take, what exercises they can do, is all of these types of things. And then I give them some ointment is for them to use it at the same time to put on there. Is now what kind of problems can we have? Well, we said 97% success, but that means 3% failures, 3% problems. And the 3% problems that I've seen is a relatively few, but usually it comes from either there's some periodontal or endodontic problem in a tooth near the surgical site. So you're making the sinus lift, but the premolar has a deep perio pocket, or the premolar needs a root canal, or the molar needs a root canal. And what happens is, if you leave that tooth there, you do the sinus graft, the infection from that infected tooth leaks into the graft and infects the graft material. The other problems that I've seen is sometimes when I extract teeth at the same time as a sinus graft, because if you extract teeth at the same time and don't clean it very, very diligently, then what you'll end up with is some of the infection from that socket, from the extraction area, from the tooth extraction area, infecting the graft material. Third is sometimes smokers, because the nicotine in the smoke, in the cigarette, causes constriction of the blood vessels. And with constriction of the blood vessels, there's less blood, which means less oxygen, which means slower healing to the area. And the fourth time that I see failures is when the patient has colds or flus, things like that. They come in, they say, I have a cold. Well, they're not breathing well, they're not cleaning the area well. We put graft material, we disturb it. So usually if they have a cold or flu, I say, you know, let's wait 1 week, 2 weeks, come back and reschedule the surgery. If they're a smoker, I prefer they limit their smoking for 1 or 2 weeks before the surgery. If it's extracting teeth, I prefer to extract teeth at a separate surgery. If I have to, we will do it at the same time, but then I have to clean out very, very well. And then you have to be sure you check the adjacent teeth to be sure there's no infections there that can infect your graft. Okay?